Alright, so welcome to my tutorial on how to treat appendicitis in Maple Hospital. And don't take this seriously. For those who want to do this in real life, you have to get a medical degree, and I don't even have a medical degree in me. So first, you take the patient to an emergency room. The emergency room is located at the right side, at the right side in the main area. And then you put them in an ear room, which is something like this. Now you do a vital check, take heart rate, and take blood pressure, which is already shown on the current task. After that, you take a vital cart, place it over here, and then you do the check. Sorry. Then you take the blood pressure. While doing this is optional. You get the patient gown, even if it just says use the computer to avoid vital signs. That's better in the future. Anyways, you just get the patient gown, then you report the vital signs, and then who actually cares about the next one, because they won't probably even understand because they're a kid or they are segregated. Now you give the patient time. Now you give them an antibiotics hygiene. If you're role playing, you say no eating or drinking. Now you can just ask the patient to raise the head of the bed, but there is bed controls, and there if she doesn't really listen to you. Now the nearest cold ice area is over here, and most people get confused, but it's just over here. All right, bro, it's just all right over here. It's just over here. Now you order treatments. You get antiemetic at Quick C's medical station. The nearest one is right over here. Now you give him antiemetic, and you bring him to the CT scan room. The CT scan is beside the MRI. For those people who have watched our recent video about treating the tumor. Now, you're about to see a grave mistake here because I gave him the CT scan 2 times, and then I start the scan early, and then I thought the next task wouldn't appear after that. Now, this is the same objective. Then we wait. That was a horrible mistake, and you will just waste lots of time. Now I go crazy on him. Now, just wait a little. Now you remove the bed by flipping the switch on the machine. And now you get him back to the ER room. After you bring him back to the bed, then you attach an antibiotics to the patient again. Now you review the symptoms. Then it's gonna be a blood sample. Then you're gonna do the blood sample test. Now if there's no people in the laboratory, then first you get the blood sample from the supply room. It's beside the urine sample. As you can see, it's right over here. Now you put on the gloves. The nearest glove is just watch. All right. It's near ER room number 4. It's right over here. You put it on, and now you draw the blood. But immediately after you draw the blood, if there's no people in the pharmacy or the lab, then you go to the tube system. And the tube system, the nearest tube system you can see is right over here near the normal rooms, where the pregnant players and the server first go. Now after that, you dispose your gloves in the trash bin near the elevator, which is optional. You can find any trash bin. Now you wash your hands in the sink in the laboratory. Only if you're solo. You can just wash it in the ER. Now you get your patient's blood sample if there's no one in the lab. Then the lab will receive your sample. Then you just go back there if there's no one in the lab again. After they receive the result, the doctor will diagnose the patient. You diagnose it with appendicitis. Now the nearest printer towards you is right over here, and then you press consent form, which is already shown in the video, or if you're just watching this while your mom is while you're watching something else. Anyways, you wait for the printer to finish. Then you give the surgery consent form to the patient. After that, he will sign a consent form, and then if it's a player, then actually every single time you have to treat a player instead of just giving them surgery instead. It's always a player. And if you want to avoid a very stupid glitch, then you're gonna have to transport the patient to pre-operations in the second level. Pre-op is near the pharmacy and laboratory. That's one of the ways you get patients from surgery. After that, your thing is ended, and now you can just claim the patient right after that. Start surgery. Now, right then you scrub in. Scrubbing in is right over here. After that, you get the steroid towel, which is at the back from the surgical prep table right over here. I swear if you're stupid and you don't see it. Anyways, they get the sugar down, the mask, and the gloves. And then you get a clean sheet from the cabinet, but I already prepared this though. Sorry. Then you place it on the surgical bed. After that, you have to wait for the patient. My alt. And then he's here. And then okay. And then now you have to wait for her to get ready. She's gonna get and then you turn on the surgical lights. This is actually optional. There's no need to do this. Now you put the oxygen mask on the patient. And now you're ready to greet them. My name is King George and I will be a surgeon today. Now you get a certificate. I prepared this. And then don't be lazy here. Just don't retry this. You just wait, be patient. And then after that, for the saline flush, you do the same thing with it. You get it from the closet, but I prepared it because it always appears in my inventory. Now you wait for the patient to fall asleep. Then you wait for the surgical nurse to intubate the patient. I don't really know what the meaning is though. Then you get the betadine bowl. I already prepared this also. And the betadine bottle. You fill it. Then you get a sponge forceps. You sanitize it. And now it's time to cut into his body. Now you make a scalpel to make the incision on the skin. Get the cautery pen. Cauterize 3 blood spots. Use the cautery pen to open the fat layer. Then you cauterize 3 blood spots. Then you use the cautery pen to open the muscle layer where you will see the appendix. Now you cauterize 2 blood spots. And it's time to get that appendix where your patient is suffering from to get out of here. Now you deploy the second clamp for safety. Now you cut the appendix clockwise. Now you also do clockwise. Now you get the forceps and drag the appendix there to the container. Now it's time to suture the muscle layer. Then suture the flat layer. Then suture the skin layer, and I get the bandage, remove the incision wound, and wait for the surgical nurse to take the patient to post-op. And I'll take a note. After the patient is got from post-op, then your patient will get another condition, which is emergency, which basically means they wake up from anesthesia. Now you throw your gloves and mask and gown into the trash can. Now you send the specimen cup to the lab through the tube system. Right after that, you log about the surgery and then you're about as done. Yep, you're about as done. Yes, you're about as done. Now you're complete. I guess. I'm very proud of you. Now the patient also got emergency. Yeah.